Their Health Talks with Dr. Trinh, the one show, maybe the only show, that shows you the way to a healthier life and how to sift through all the noise and craziness out there today and make sense of all the health talk taking place. With the man who always makes sense, Dr. Trinh. Welcome, sir.
Anyways.
No funny comments this morning here? Usually I say something and then he has a funny comeback here. I said that the always guy who always makes sense. You going to make sense today here, Dr. Trinh? Oh, Dr. Trin's struggling to come in for some reason here.
I'm here. Sorry, I'm getting my internet went out a little bit.
Oh, okay. So are you going to make sense today? Are you going to give us some sensible advice?
Sense.
Okay.
We're with UC Clinic today. Our friends and buddies who currently is partnered with a number of organizations, but OC Public Health is a major partner with the organization. They are doing a great job with COVID testing throughout Orange County. And so, Vince, what are we looking at there?
Good morning, Dr. Trinh. Good morning, Paul. How are you guys?
We're good. What are we looking at?
Again. So we're at the Orange County Fairgrounds round. This is the entrance right now with all the cars coming in. Just want to give you guys a quick dash over really quick of all the stations, the testing areas. And we can drop through really quick as well, too, while we talk.
Yes, we have today Linda, Mike Lee, and Nargis on as well. And maybe you guys want to introduce yourselves a little bit and tell us what you do for the organization.
Mike?
Yeah, I'll start.
Okay,
So I handle community relations, pretty much working on the marketing side, PR side, working with nonprofits, community organizations. And that's what I enjoy doing.
And let's clarify, Linda, is it, I always want to say win because that's what I was taught, but Dr. Trinh always tells me it's Nguyen. I can't believe that.
Win. All right, Paul, I'm a bad Vietnamese.
All right. Okay.
Not Nguyen.
Nargis, would you like to chime in and provide a little background on yourself?
Yes, sure. Good morning. My name is Nargis. I'm a nurse practitioner and Chief Clinical Officer with 360 Clinic. I take care of the clinical side of the organization. With our clinicians, we are able to see patients when they come in through testing and also follow up with them when they test positive through our telemedicine services.
And 360 Clinic is what? Are you an independent testing organization? Are you going to give out vaccinations? What is it that you guys do?
Well,
We're actually, go ahead, Linda.
No, Vince, go ahead.
Yeah, we're actually a medical group, Paul, that, 360 Clinic was born actually with many of our experience, many years already in the home health and hospice system. But really 360 Clinic was born out of the pandemic to help the needs of the community. Yeah.
And what is it you do at 360? Do you see patients across the board, or is this just related to COVID?
We see patients. We have medical doctors that see patients across the board. This is something that we came up with just to help the community in the time of need in the pandemic, and then to keep our nurses busy and go from there. Yeah.
And so you run a testing site in cooperation with the County of Orange, where we're looking at you, I assume.
Yeah, at the Anaheim Convention Center and also Orange County Fairgrounds. Last time we spoke with you, we didn't open the fairgrounds yet. But now here with the fairgrounds, we opened in August, and currently we're doing 5,000 patients a day. Wow. And also we opened multiple access points, be it with our kiosks. Around 15 kiosks in Orange County as well.
Wow.
And each of those kiosks, can take 500 patients a day.
So tell me how it works, how people sign up, and do they have to have an appointment?
Yes, appointment is needed. They can go to 360clinic.md, click on no cost testing, and it will direct them to the registration site. Right now, due to our increased capacity, we can take on walk-in patients as well. So if anyone that needs to get a test right away, they can just swing by the site with their appointment number, or our team here can help them with the appointments and get a confirmation number and get a test right away. The turnaround time right now we're seeing for 24 hours.
Wow, that's phenomenal. Because talk about that, Dr. Trinh. That was one of the big problems here. People were getting the results a week later, and what did that tell you?
Tells you nothing. By the time you're a week out, you've already been in contact with your friends, family, and everyone else.
Right.
A week later. So 24 to 48 turnaround time is excellent and appropriate.
And somebody wanted to know, what's the site again? It's 360 Clinic.
.md.
.md. I didn't know there was a .md extension.
Yeah, .md.
Okay. All right. So you're testing people. Why is it that so few people could get tested in the beginning, and why was it taking so long?
Linda?
Not just from, as across the county, it's across the country. What was the problem for so long? Anybody couldn't get tested. And if they did, the tests were taking so long, they were meaningless.
Well, to be truthful, the community didn't expect the surge of tests. The holidays, and as human behavior results, cohabitation with family meetings over Thanksgiving and Christmas and New Year's really put a real stressor on the overall testing ecosystem. We ramped up our testing capacity by threefold during the holiday season to accommodate this surge. And we were still able to deliver the results back to the patients and the community within 24 to 36 hours.
Wow.
Wow.
One more question.
Yeah, and that was Mike Lee, our Chief Administrative Officer.
Hey, Mike, come on and tell us about yourself.
Yeah, right.
Oh, hi. Sorry about that. So my name is Mike Lee.
He's the driver. I didn't know he's driving this organization. I can tell that he's driving.
He is. Oh, very much. He is.
My number one job is to get in this golf cart and drive around all day. I love it.
Good thing it's just a golf course.
We'll do that next time. Soon. So I'm the Chief Administrative Officer of this organization. I've been with this organization as of recent and really contributed to the great team here in establishing as many access points to the community. As we all know, with the surge in volume of the testing, and even if the vaccinations are coming to accessibility with the public, we still need to maintain a basis of testing access. So we understand that demand and need, and we are committed to continuing to deliver this service back to the community of Orange County and all the other counties surrounding that expects us to be there.
Where are you at now? Just in Orange, or are you expanding into other counties?
We are expanding. We are in discussions with a lot of other cities and municipalities that are looking at our success and that we've sort of accomplished here in Orange County. And we're eager, we're hungry to expand.
So why are there not more organizations like yours? I thought everybody would see an opportunity and there would be hundreds of groups like yours doing tests at hundreds of sites. And instead, as far as I can tell, you're the only one, other than the county has given out. The county has a program where they can send you a test kit. I think a few other places here and there, but it still doesn't seem like it meets the needs of the community. So why are you one of the few or the only doing this?
Well, we are not. There are other outfits that are doing this. Let's see, the diversity of the providers could be simple laboratory testing providers. So
right.
All they do would be to collect the samples and run the results and give the results back to the patients. That's one avenue. And then there are other outfits such as us, sort of stay in the middle of the lane of the ecosystem that not only provide the services to collect samples and facilitate the logistics with the laboratory, but really enforce our army of clinicians to make sure those patients that have tested positive are educated to the levels where they can manage their condition. So our primary differentiator is the fact that we have a medical group and an army of clinicians to complete the wraparound service from a clinical aspect.
So let's
And
talk
then
about that. Let's talk about that, Dr. Trinh. What happens? Let's say I test positive, God forbid, tomorrow. What you just send me a note and you tell me, your nurse calls me up and says I'm positive, and then I go, now what? What is the wraparound? What is the follow up?
The wraparound is that if you test positive, you are first informed by 360 of your results, and then you're offered the opportunity to speak with one of the clinicians at 360. So Nargis is one of our clinicians along with others, and so you're not left in the dark. It's like, I'm positive. What do I do now?
Right.
And so you get reassurance, you get some recommendations, and so we get to hold your hand throughout the entire process as you need.
And people, a lot of talk has been given over the last 6 months about different, what do we call this? Different treatments, different protocols, how to deal with this. Apparently, we've gotten better at it. Fewer people as a percentage are dying. I don't know if that's true or not, but that seems to be the perception. People still get sick, but we've learned how to handle this better. Do you guys help handle it? Do you admit? I mean, do you give people any sorts of treatments? Do you give people, tell them how to go get oxygen if they need it or what? I don't know what happens next other than hang in there, you're sick.
I think Nargis can touch upon what we do on our end, and Dr. Trinh can touch upon what he does in the...
Okay. Because everybody's frightened. All of a sudden, it's like a death sentence. You've got COVID.
That's right.
Doesn't have to be that way.
Exactly.
So Nargis,
like Dr. Trinh mentioned, once we get our detected cases, we schedule them for a telemedicine call. One of our clinicians will call and, kind of assess patient's symptoms, situation, living situation, what's the work situation, and all that. If they need a work note, we offer it to them. Normally what we find out is that patients are in the dark, just like Dr. Trinh said. They don't know what to do.
Yeah.
What about their family member? What should they do? That everyone tested positive, the other one tested negative at home. So there's a lot of education that goes on with our telemedicine call. And we find a lot of patients that are uninsured and they don't have access to healthcare. They don't have PCP. So when we call, they're literally in tears, really thanking the service because we're able to talk to them and not only educate them, but also diagnose them with maybe some, like asthma-induced attack or any, like any pneumonia going on, so we can prescribe them medications. We call them into their pharmacy and ask the pharmacy to deliver it to them.
so you can do that. You can actually do a telemedicine call. I can talk to a real doctor or nurse or clinician or somebody here is going to give me some real walk through my symptoms, give me some initial diagnosis, and if need be, can even prescribe some medications.
Yes, we prescribe medications, call it into the pharmacy of patient's choice.
Wow.
And also if patients are symptomatic, we schedule them for a follow-up visit. So we walk them through these 10, 14 days of quarantine time.
I'm assuming that most people, again, they say, most people are not going to get that sick. They'll feel sick, but they're not going to need to go to a hospital.
Right.
When do you decide it's time to go to the hospital, doctor? Dr. Trinh, tell us walk us through the progression of this disease. For some, it's just stay home and self-quarantine. You're going to feel sick. For some, we got to watch you because you're getting worse and it's time to go to the hospital.
There are there's a good number of standard recommendations once you're diagnosed with COVID. And the two things you should have that we recommend with each patient newly diagnosed is that you have to get a thermometer to check for fever and things of that sort. But the second thing you should have is a pulse oximetry machine.
A what?
That little thing that you put your finger and it checks your oxygen level. The little oxygen reader, and it tells you what percentage are you at, 90%, 95%, how are you oxygenating, right? And And we recommend that our COVID patients check every day their oxygen levels and, of course, to monitor their temperature and symptoms. There are some criteria where you should be in the hospital or be evaluated, in the urgent care or ER. And that's when your oxygen level drops, under, like 90%, under a percentage that puts your body at risk for not getting enough oxygen. And so those are the criteria we give to our patients, and to give them some education on how to deal with this on a daily basis.
You are the first person in almost a year now, we've been into this, 9-10 months into the crisis, who has ever said, monitor your oxygen levels. I don't know that I don't know where to buy one of those devices. I've never heard of a run on those devices. There was a run on toilet paper, but nobody was running out to get an oxygenator or whatever the thing's called. What's it called? What's it called again?
It's a pulse oximetry device. It's that little thing on your finger. I was able to buy one at CVS Pharmacy, just locally. You can buy one. Who knows? Maybe you can get a package that goes with a toilet paper roll. Put together our own 360.
Type that into the notes so everybody doesn't have to spell it here. Put that into the notes of what those things are. Maybe you can even put a link to Amazon or CVS or something.
Definitely. I'll put it on our Facebook chat here.
All right.
Yes,
so that should be your first step. Monitor your temperature, monitor your oxygen levels. And if those start to change dramatically, then it may be time to go into urgent care and because some people are going to get super sick of this thing. Well, tell me what happens when you get super sick and the time frame. Do you get super sick in 24 hours and you better get there quickly, or does this take a week to develop? What's the normal progress once you reach that point?
When I see a patient who arrives to the ER, so for example, I was in the ER 2 nights ago admitting patients, and 50% of the patients I admitted were COVID patients.
Wow.
But usually when I see a patient in the ER, they have been sick for about a week. So what happens is you get diagnosed and you try to handle it at home.
Right.
You're resting and you're trying to breathe and you're taking your Tylenol for your fever. You're doing whatever you can at home. But at some point, your symptoms get so bad that you can no longer handle it at home.
Right.
And that may include, shortness of breath. You can no longer breathe. You're getting super tired. Your fever won't break, right? Your 102, 103 fever won't break. That's when patients normally arrive to the ER. It's usually around week number 2, unless it could be week number 1 if they have been sick for some time before they even get tested.
Right.
Right? If they've been sick for a week to 2 weeks and then they go in to get tested, sometimes you get tested and you're almost crashing, right?
Yeah.
And
right.
I've seen that. So it varies, but usually from the initiation of symptoms, from the start of symptoms, day number 1. It's usually around between week 1 to week 2 is where we start seeing patients arrive in the ER. And that's just a general rule. It's not it's not like a formula that's perfect.
Have we come up with any statistics that make sense? In the beginning, we thought this was 10 times deadlier than the flu. Maybe it's only 5 times deadlier than the flu. What percentage of people, do we have any data coming in yet after all this time of how many people progress to that stage and need intervention?
Statistics are very simple. We've had over 400,000 deaths in less than a year. We don't have 400,000 deaths a year from the flu, do we? We don't even have 100,000 deaths from the flu a year.
Wow.
We have less than that. And so if you look at COVID deaths in less than a year, which is over 400,000 now, and you look at flu deaths per year, obviously the COVID deaths are multiple times of that of the flu. And it's not just talking about deaths, right? There's this argument that we shouldn't worry because, only 1% of, everyone who gets COVID dies and things of that sort. When I look at COVID, I don't look at necessarily the mortality numbers. I'm looking at the information that's coming out about this long hauler syndrome, right? patients who have had COVID months ago, the virus is now gone, but they have not recovered. They're still sick. They still can't breathe, right? They still don't have their taste and smell back. They're still chronically fatigued. They have brain fog, right? Their memory is worse. They can't focus. And so that's what we should really be concerned with. Yes, deaths are high, but what's more worrisome is that you may not recover. We don't know when you'll recover. If you go to these Facebook groups where there's a bunch that's popping up now, it's called like coronavirus survival group or support group. There are like thousands of people in these groups. I'm in several groups. One has 10,000 folks in it.
Wow.
Another one has like 30,000 folks in it. And you should see what's posted in there. And what's posted in there is like, I've had COVID 6 months ago. Why am I still sick?
Yeah, right.
Right. I've had COVID, 3 months ago. Why can I not smell? Why am I not back to where I was? And that's what we should be concerned with, because this is such a new virus that we don't know the long-term consequences. And
Some even anecdotal suggestions that maybe you've got damaged heart or a permanent damage to your lungs or other sorts of things that you won't recover from. This will always be a symptom, or you'll always have a weakness or a problem.
yes, what folks don't understand is that COVID is nothing like the flu. Right? There was a study published where they did autopsies of 7 patients who died from COVID, and they autopsied their lungs. And they took 7 patients who died from the flu, and they autopsied their lungs, right? So you're comparing 7 COVID lungs to 7 flu lungs, right? And patients who died from these conditions. And the lungs look nothing alike, nothing alike. The patients who had COVID lungs had 9 times the inflammation damage that was seen in their lungs compared to patients with the flu who died from the flu. So COVID is an inflammatory disorder that causes blood clots. And when these blood clots, depending on where they occur in the body, right? If the blood clots occur in your heart, you have a heart attack. And I've admitted more than one patient with COVID coming in for heart attacks. If the blood clots occur in your brain, we call that a stroke, right? If the blood clots occur in your lungs, we call that a pulmonary embolus. So it depends on the location of the blood clot that brings on all these other conditions associated with COVID.
So let me ask you 2 more questions about that, because one of the misinformation, in my opinion, and this tends to be everybody knows my point of view. I tend to be more of a liberal, a rhino here. One of the things I hear on conservative media all the time is too many people are that the numbers are inflated. He or she didn't die from COVID. They died from a stroke. They died from a heart attack. But you're saying the heart attack or the stroke was induced by COVID. COVID caused.
100%. Yes. 100%. That's what people do not understand. They don't understand that if COVID was not there, that person would have never had their heart attack. That person would have never had their stroke or their pulmonary embolus. Those conditions would have not occurred without COVID. So yes, there are comorbid conditions, but they're driven by COVID.
Okay.
So yeah.
All right. So having said that, have we gotten better at treating this? Has the death rate gone down? And do we know any more about this long hauler symptom, or is this going to take a long time to figure out?
We definitely are more experienced with treating this. So, patients arrive in the ER, I have my cocktail of COVID medicines already in my mind, right? Depending on their oxygen level, depending on their inflammation level in the lab. So we know, and we're very familiar with the treatment of COVID now compared to a year ago, right? Compare last June or July when we're just messing around and experimenting with different things. So yes, we're definitely more comfortable. It does not mean that death rates have been lowered, because the number of cases today with COVID is much higher than it was last summer. So, you know, it means there's more hospitalizations today than it was last summer. And we pray that we have the hospital beds available and ICU beds and things of that sort. As long as those beds are available, we can keep the death rate low. Once we run out of those beds, then we're in trouble.
And then when do you think, you're a researcher, is this going to take a year or two? We're going to have to look back and see what the long haul implications are for some people?
Yeah, we're starting to see the implication of long haulers already. We are launching clinical research, and a lot of funding is going to COVID clinical research currently, including launching programs for COVID rehab, post-COVID rehab. Very important, right? You got COVID, the virus is gone, but you're still sick, right? You still can't breathe, you're weak, you can't, you know, your mental status is different, you can't focus. So we need post-COVID rehab. We need rehab that's focused on cognition, on the brain. We need rehab that's focused on mental health with the depression, the anxiety, the PTSD from COVID.
Yeah, right.
We need rehab for the lungs, right? Pulmonary rehab. How do you improve your breathing? What kind of breathing exercises can you recommend for me to improve your breathing? And then we need rehab for all the other comorbidities that are associated with COVID. The weakness, the physical weakness, the stroke and the heart attacks that have resulted from COVID. So there's multiple modalities of rehab that will be required for to take care of this. This is going to be the next wave. Once COVID is over with, right? Assuming, you know, America gets their act together and we get the vaccinations in there and all that. Once COVID is taken care of, as far as new cases, we have to deal with the damage that's done. And that's where rehab comes in. And that's going to be the next era.
And I don't hear anybody talk about that. Somebody, before I'm going to go back to your guest here in a second here. One of your audience, Alex, wants to know, you're a big proponent of CBD and cannabis to cure or help with lots of things. Any initial thoughts on cannabis and COVID?
COVID and CBD and cannabis. Alex, well, it may make you happier.
Because there's some anecdotal evidence that suggests, and I know it's a long way from proving it, that CBD may actually help treat or fight cancers and some other things. There have been suggestions about that. I don't know if that's true or not, but there have been suggestions, and some people swear to it. What do you think? Any long-term implications? Because cannabis helps, or CBD helps fight inflammation.
It does. CBD fights inflammation. It's an anti-inflammatory. It helps with the endocannabinoid system. I'm actually giving a few CBD talks coming up pretty soon, and I'm sure we'll discuss COVID as well.
Okay.
Alex, to answer your question, we actually don't have the clinical research behind that yet to document CBD's effect on COVID. But I can tell you, that in general, CBD is an anti-inflammatory, and it works through the endocannabinoid system. And knowing that COVID is an inflammation disorder, right, that affects inflammation, it's a good hypothesis to say that CBD may play a role in that. We, of course, need to do the research to find out, but I would be optimistic in that as well.
So let's come back to Vince and 360 Clinic here. As your mission right now, you're a regular medical group anyway, and this extra effort you're doing is to get out in the community, our community, and perhaps other communities to test. Will you guys tackle this next round as well? Do you anticipate setting up, clinics, programs to help rehabilitate patients as well? Do you see that as an opportunity? Is that an area that are you just solely focused on testing?
Yeah, absolutely. We're currently working with our doctors and many doctors here in Orange County as well on that post-COVID rehab. And I think it's very important to mention about the mental health as well, the PTSD that's coming after that as well. We're looking into that, and we're doing a couple of project planning to after the wave of taking care of the vaccination projects, and then we'll get right into the post-COVID rehab as well.
I'd love to know if any of your audience has had COVID. So far, we haven't had anybody on that's listening that says, I've got it now or I had it. I'd love to hear your reactions to it. Did it just go away after a week or two? It was a tough, it was, I hear people, I've known now some people who've had it. Some of them said, oh my God, it was like the worst cold or the worst flu I ever had, but I got through it. A few have, one or two have said, no, I can't seem to snap out of it. Even though the disease is gone, my symptoms remain. And I hear more and more, not from my personal experience, but from anecdotal, of this post-traumatic stress. Is the whole country going to be in for some sort of post-traumatic? Is there a delayed reaction that's coming when we finally come to grips with this? And so many people are depressed and down and defeated and whatever. It just took too long. They were too isolated. Talk about that aspect of it, that mental health aspect. I'll throw it to Vince here. We'll let you guys, or maybe Linda, maybe she's the marketing person here.
Oh, yeah, Dr. Trinh, I don't know, if you have any statistics on the suicide rate.
Oh, yeah.
Yeah, I think that's good to touch upon.
Yes. Suicide rates, suicide attempts, definitely higher during this pandemic.
I'm stunned at the number of healthcare professionals who take their own life. That's inconceivable to me. What is it? They're just so, it just seems impossible to stop and they just give up, or they're just so burned out and tired they can't go on anymore here. Talk about that in your profession.
Overworked. There's, every time a nurse or a physician catches COVID and gets COVID, they are removed from the workforce. What that means is that the others need to take their place. Think about that. And if you only have a limited number in the workforce, and our healthcare providers are coming down with this, the others need to replace that position. And so many docs and nurses are working overtime. They're doing more shifts than they normally would have done. And they're tired. They come home and they have to isolate themselves from their family often.
And it's that overwork, stressed out, isolation. Isolation is the thing that strikes me. I've said this over and over again. I don't know why nobody else has picked up on this. Maybe I'm the only one seeing this, but every other health crisis we've ever had to go through as a group, every other crisis, a shooting at a school, a mass murder in a community, 9/11, we gather together and comfort each other. We go to the bar, we go to the church, we go to each other's houses, and we cry and hug each other and hold each other and say, we're going to make it through this. This is the first crisis I know of where we're told to do this alone. We're told to isolate and survive. That doesn't seem like that's a healthy reaction for most people. Any thoughts on that, Vince or Linda? What are you seeing out there as you treat patients?
I mean, good thing we have technology like Zoom and we can still keep in contact with each other.
Right. I think that imagine if we couldn't. Imagine if we were just all flooding the phone line saying, I'm feeling terrible, talk to me.
Yeah. And I just want to elaborate back on the nurses, finding replacement for nurses at the hospital system, because currently right now, with the hospital system, usually they take student nurses into the hospital and the facilities for training and intern. But with our medical group, we have built curriculums with the partner school like Golden West College, Concordia, UBI, West Coast College, to continue that nurses training, right? And then to predict the future, that in case that we continue the training and the graduation of nurses rather than just letting this pandemic put a stop to it, right? And then Linda, if you want to add on to that as well.
Yeah, what's also great about that, our student interns is that there's a opportunity to hire as well. And I know one of our staff members at Orange County Fairgrounds was a intern to hire. So we definitely would love to take on more and have more partnerships with schools, colleges,
So here's what I worry about. I worry about so many things these days as I get older here. But one of the things I worry about is, are we ready for what comes next? That's what you guys were hinting at. We've gotten everybody vaccinated that'll take it. The rate of transmission is down to low or nothing. It doesn't go away, but it's under control. Now what? Are we ready? Do we just go? So many of us just want to close the book on COVID and pretend it'll never happen again. It'll never come back. There'll never be anything like this. Nor are we prepared for the long haul treatment, the post-traumatic stress, the burnout, the stuff. We seem to be so focused on the now that we don't want to look ahead towards what comes next. What do you guys, we'll go around the horn here, not just Vince, but your partner there. What do you think? What comes next? And are you thinking of, what are you doing to prepare for what comes next?
We understand the need to create that continuation of coverage as we deal with the aftermath of all this. Whether or not there will be a true definition of aftermath, time will tell. I think we understand that COVID is going to be here for a while. And understanding the post-traumatic effect, the mental health aspect of it, we understand that demand and need and have prepared an entire homebound system where the part of the telehealth module, we're reaching out to the community after they've tested positive. We understand the need for additional social deficits, then we'll gather around the social resources that are available in the community and connect them. So we do a lot more than just testing, as I was emphasizing earlier. We provide the whole entire wraparound service that not only impact the clinical need of that individual, but also connect them to the social resources that are available for certain situations. So we help the individual deal with the crisis when it comes to isolation deficits, language barriers, food deprivation, whatever it is that we can to provide the additional layer of support.
And why is this hitting certain communities so much harder? Communities of color, immigrant communities, less affluent communities, poorer communities. Is it simply because poor diet, more people packed in a house, less access to health care, lack of insurance? Well, talk through some of those things. You must be seeing a lot of that now. You talked about a little bit. I'll let you go around. We'll start with Linda here. Why is it impacting certain communities so much harder?
Yeah, I think you just listed all of it, mainly multi-generational homes. You know, they have no choice. They have to work. Some are unable to quarantine and self-isolate. They're still getting out there, they're working, and they come home, and unknowingly, you know, during the asymptomatic phase, that's when they're spreading it, and it goes to their children, their parents, their grandparents who live in the same home, and by the time that the symptoms develop, everybody else has caught it by then.
And obviously in certain communities like Vietnamese communities, that isn't just something they do out of necessity. That's part of the culture. You take care of grandma. You take care of the elderly. You respect that. You don't just pack them up and ship them off somewhere like so many of the rest of us do here. And that seems to be coming back to bite them in a certain way here. That proximity to multi-generations is what's keeping this thing flaming in certain communities. Do you see that in the Vietnamese community?
We do. I was in the ER the other night, and probably 30% of my admissions for COVID were Vietnamese.
Really?
Yeah. And you're right, because Vietnamese, in our culture, in Vietnam, there's no such thing as nursing homes. Right? Grandma gets older, grandma lives with you, right? Parents live with you, and we're multi-generation, and it's our culture, it's our belief to take care of, folks who have raised us, and so we have this respect and appreciation for the multi-generational family. The problem is, grandma lives at home, and one person brings COVID home. and the entire family is infected, and then I end up seeing grandma in the ER is normally what happens.
Yeah, right, right.
Yes. And I would say it's probably the same for Hispanic
Right.
communities, and a lot of these are minority communities. Our culture's a little bit different, and it's generation with that.
Persian communities, Iranian communities, other communities like that, where it's very common to see multi-generations. Whereas if I go up and down my neighborhood, it's hard to see many multi-generations here. It's one generation in the house.
By the way, if grandma cooks well, then she actually stays there the entire time.
Yeah.
So,
Yeah, exactly.
yeah.
We had, I don't know if Alex is urging Leanne, we're not going to try and call her out here, but apparently she is somebody listening this morning who's experienced COVID. If you could share any of that, we'd love to hear it. If you're comfortable with it, if you're not, I understand. Tell me a story, Vince, of somebody you've seen that you've served. Let's put a face to this. Give me some COVID stories here.
Well, I mean, just yesterday, I was with Mike out onto the last station, the provider station, and we had someone come through, and they didn't realize it, but they really needed to go to the hospital, and they were trying to get the test from other locations. They finally came through. One of our providers spot that out right away, gave them checked the pulse ox that Dr. Trinh just mentioned, and their oxygen level way too low, and we had to call the emergency 911 for them right away.
Wow.
So things like that happen here at our site all the time, and with our clinician staff, we're prepared to deal with that, right? I believe with other testing sites, they only have non-professional healthcare professional people there just collecting the sample.
Just intake people. Yeah,
Absolutely. Yeah, so here we have clinicians on site ready to make that call and call 911 and send people right away too. And then I've seen cases where even our clinicians on the telehealth with the patient, asking them how you're doing, checking them on it, and advising them, hey, if you're feeling this way, if you're short of breath, respiratory issues, you need to check yourself in right away. And those are the things that, of course, we try to alleviate, right, the hospital system, but if really necessarily, we're prepared to assist the patient into getting to the urgent care and seeing a doctor, someone like Dr. Trinh, to help them right away. Yeah.
We called out one of our audience, Leanne. She's apparently driving and listening at the moment, but she said she'll respond. If not now, in the future, we really need to hear more of the stories, because again, people are going through this alone, at home, isolated. I don't go over and talk to them and say, hey, how you doing? I don't communicate. The minute they got it, they're a pariah. It's like they've got, what's the disease that where your limbs fall off and everything? Leprosy. They're lepers. Exactly. They're isolated. They're shunned. Don't get near me. And so we don't know until we go through it, or someone we know goes through it. We don't really have much understanding of this, I think. And I think that's part of the fear that plays into this. Let's talk the last 10 minutes here. We got about 10 minutes left. Vaccinations. I'm very, very, very disappointed, like many people are, at the slow rollout of vaccinations. When is this going to get better? And are you guys going to play any role in vaccinations?
Yeah, so vaccination, our team has been spending weekends with the Althena team and the OCHCA to help them roll out with the software issues and stuff like that.
Which have been horrible, by the way. The site crashes. It overloads all the time. I can't believe it. All this time.
When you need technology the most, it just, fails on you. But anyways, the team is great. Althena team is great. They're very intelligent guys that are going to get this up and running really fast. We're contributing on our side as the provider group to make sure that there's providers on site to do this in the future as well. But vaccination, we're talking to San Diego County, LA County as well, to help them assist them with that right away. It's a huge need out there, and also San Bernardino County as well.
How about Orange here? Right now, we had the Orange County Fire Authority, which was doing some for companies, and I don't think they take walk-ups, although I heard that if you force your way in, sometimes maybe they'll let you go in, but and then Disneyland was supposed to be a site. We got 2 sites for 3.5 million people. Can't we do faster or better than this?
Yeah.
I think more importantly, we want to make sure that it's rolled out correctly, because we want to make sure that the vaccine is transported and stored correctly. So we definitely don't want to rush it. And I understand how how quickly people want to get vaccinated. And we want to make sure.
I want to get vaccinated today, and I can't even get on the darn site. It's crazy. It's frustrating. You go over and over and over again, and then finally I got registered, and all it says is, check back tomorrow. Check back tomorrow.
Paul, do you know why? Have you heard that it takes about an hour, 2 hours, even at Disneyland, in the wait to get a shot?
My wife through her work, they had some program set up, and they were able to get her an appointment and to get her in, and it took over 2.5 hours, and she said it was very confusing. She got in the wrong line, and she had to go start over and everything. Crazy. And she's the one that said there were some people just running up saying, I don't care, I want it right now. And they were like quietly saying, okay, just step to the side. And some of them were saying, no, sorry, you got to get an appointment. Forget it, Charlie. I don't care what you think.
Do you know why it takes 2 hours to wait at Disneyland for a vaccine shot?
I have no idea.
It's because it takes about 2 hours to get into Space Mountain.
So it's all the same.
Say something like that. I was waiting.
Waiting for that. That's, yeah. It's,
no, unless you have a fast pass, right?
Nothing has changed. Then it's all the same.
Yes.
I was waiting for it.
He's always got some crazy take on this, but really, I think people are getting frustrated and fearful. There is a vaccine. We all want it. I get that they got to manufacture it and they got to distribute it and it's got to stay cold. We've heard terrible stories where it went bad and they threw it away or something happened. Are there, one of the other urban legends is that there are supplies of this sitting around. I don't know if it's at CVS or someplace, and it's going to go bad. And we got to give it away. And if you sort of secretly find one of these sites, they'll go, come on over. We're going to throw this away tomorrow, so come on over. We'd rather stick it in your arm than throw it away. Is that true, or is that just a myth that's spreading, that if we search around, we'll find the person that'll give it to it right now because they were going to throw it away? What do you think, Linda or Vince? What do you think? Are you seeing any of that, or is that just another rumor flashing around here?
I think that's hard to comment on. I mean, when it comes to oversight of not only the distribution, but actually the administration of the vaccinations, the pre and post logging of all of the lots, who is getting the vaccination, all of that is reportable. So it'll be hard to, identify those cracks in the system, not to discount that they do exist. But when it comes to just access to the vaccination, it's pretty ironclad. So,
what about the follow-up? Because now my wife is worried, oh my God, it was so hard to get on the site and get in, and I got to get my second shot within 28 days or whatever it is. There's different time frames depending if you got the Moderna one or the Pfizer one. And what happens if you're late? What if it takes 6 weeks to get it or 8 weeks to get that thing?
I think Dr. Trinh would be better equipped to address this situation, but after that, the 8-week period, the 28-day period, Dr. Trinh, would you mind making a comment on that?
I mean, if I don't get it in time, have I blown the whole thing?
No. So the answer is we actually don't know. As far as if you waited an extra month out versus 2 months out. And it doesn't mean that it's not going to work. All it means is that we didn't study it, right? In the clinical trial, it was very focused on, come back in 3 weeks, come back in 4 weeks for your second shot for that booster. The question is, if you came back in 2 months, what would happen?
Yeah, right.
And my guess is that it will be effective still. The question is how effective. Is it going to be less effective? Is it going to be equally effective? And the answer is we don't know because we didn't study that in the research. So that would be the appropriate.
And here's the other I'm giving you all these frightening, fearful things flashing around the internet. One is that, oh my God, I'm not going to get the second dose. The other one is, oh my God, there's stuff going unused. One of your one of your audience here, William, up in Canada, says he knows of people that actually pull them in off the street at the end. Here, we were going to throw this stuff away. We might as well give it to you. Some of that cracks in the system, as you're talking about here. But here's the other fear. Poor Lou Correa, our representative from Santa Ana, in the midst of the Capitol insurrection and chaos, was huddled together and got COVID after he had already taken his first shot. He was waiting for the booster, and he still got it. Wow, I didn't think that could happen. We somehow thought the first shot would fend it off. Do you take the full 2 to feel the effect?
The first shot gives you about 50% protection. So you're still at risk 50% of the time.
Wow.
The second shot is what gives you the 95% protection. But even with the second shot, there's still a 5% risk of.
And how long is it last? 6 months, 6 days, 6 years, your lifetime? We don't know yet, right?
We know with Moderna. Moderna says that their shots, their 2 shots, will be good for 1 year. We haven't heard yet from Pfizer. We haven't heard from AstraZeneca or J&J. By the way, Johnson & Johnson has some really good data recently. And in their preliminary data, the cool thing with Johnson & Johnson is that it's only a 1-shot deal.
Didn't know that. Didn't know that.
And so Johnson & Johnson's results was, I believe, about 90% effective with just 1 shot.
That's interesting.
So they're coming up pretty soon to be evaluated by the FDA and approval. So hopefully within the next 2 months, we would have multiple vendors of vaccinations.
Which means more manufacturers, more options, more sites, more everything. Give us, Vince, give us your site again. Right now you're doing testing and the follow-up program, which is so important. You're not just giving me a test result and you're doing it quickly, but you're also holding my hand and walking me through this process, this scary process afterwards. Looks like lots of open spaces there. We got to get over and get tested.
Yeah. Come on by, Paul.
So where, when, how? Give us all that information again. How do we get tested through you guys?
Yeah, so you can go on 360clinic.md, click on no cost testing, and you should be able to find an appointment right away. And if not, you can swing on by and our team can help you here for on-site registration as well.
So you are taking walk-ups at this point here too, if somebody just wants to drive up. You're suggesting an appointment, but maybe...
Yes, I'm sorry, I mean drive up. For the fairground, it's drive up.
It's drive up. Okay. Well, what percentage of us have been tested? I haven't been tested. What do you think of the population, Dr. Trinh? 3.5 million people, roughly, Orange County.
Most of us,
I think like around 2 million. Last I saw 2.5 already.
Have been tested. Okay, that's
Yeah.
good. And do you have to get tested multiple times? Do you get tested a month later or 6 weeks later, a year? I mean, it isn't just once and done. You might get tested and 2 months later get sick, right?
Right, that's correct.
So it's a thing. If you're at risk, you should probably be testing regularly, more often.
Yes.
How often should you get tested? Or can I get tested every day? Can I get tested every month? What? I'm paranoid.
I mean, I would recommend that if you've been exposed or if you have symptoms to be tested.
Right. That makes sense. All right. One more time. The website is 360clinic.md. You guys are doing good work. I appreciate that you've stepped into the breach and made testing now not our testing doesn't seem to be the problem anymore. Where in the beginning it was all about you couldn't get a test and you couldn't get a result. You guys and others have solved that problem. Now the next question is getting the vaccine in everybody's arms and dealing with the long-term implications of what happened with this disease, right?
Absolutely, Paul. That's correct.
Okay. Well, I hope you'll keep us informed as to what's happening. I hope you will get into the battle to get vaccinations, because right now it ain't working very good. I'm sorry. The system is slow and cumbersome, and we need you, just as we needed you in the beginning to test, we need you out there sticking this in people's arms desperately.
Definitely. We're eager to help. Thank you, Paul. Thank you, Dr. Trinh.
Okay.
Thank you, everyone.
Thank you.
Thanks, Linda. Thanks, Mike. Thanks, Nargis.
Thank you.
Final thoughts,
Thank you,
Dr.
everyone.
Trinh, on the state of COVID today here. We've made some ground, but there's still a lot of way to go.
still a lot of ways to go for sure. And I'm just thankful that 360 Clinic is here in Orange County. They have played a really significant role in making a dent with diagnosis, with treatment, and hopefully soon with vaccinations and things of that sort as well.
We'll have to put you in touch with Vivian, who's on the site saying she's having trouble getting the link. Maybe she's just having trouble connecting, but it's 360 clinic.md, right?
MD, yes, that's correct.
Okay. All right. Well, thanks for coming on. We definitely appreciate the work you're doing, and we hope you will jump into the bigger battle soon, because that's the next wave. And then the third battle, which we don't even think about, which is the long haul implications, the long haul therapy, the long haul treatments, the long haul assistance for those that can't snap out of this or don't snap out of this. Thank you again for all that you're doing, and come back and keep us updated, will you?
Absolutely. Thank you so much, Paul.
All right.
Thank you, everyone.
Have a good day, everybody.
You've been listening to another great example of Health Talks here with Dr. Trinh, right here in Orange County's only community radio station, OCTalkRadio.net. Quick question as we end our Facebook session here today. Let me just tune this out. Hang on.